my sincere thanks to Dr. Rajendra Chandak and Dr. Anita Gargi from the Baba Atomic Research Center Hospital, which proposed that this type of a very important webinar is going to be there, and then whether I can share my views in this. And it's a great opportunity for me that first time such a special that webinar on C-arm is there, and then particularly the safety aspects I have to share on this. So thank you very much for this. I will start my presentation, and sorry, this one, I will not go much detail into this because you all know what is ionizing radiation also. I think, See, only what I will like to mention here is that we come across the C-arm and cath labs very commonly in medicine, and today we are discussing on C-arm. What I wanted to mention about, inform you about this is that C-arm rating, if you see, it is just in the range of 20 to 25 kilowatt, while the maximum kV is 120 kV, and MA, very important factor, tube current is only of the order of 10 to 20 MA. Well, if you see in the cath lab, these generator ratings are very high. So definitely the cath lab gives much more radiation output than the C-arm as such. This slide is only for your just information. And C-arm being, again, it is actually the mobile fluoroscopy unit. With a very low MA. Only thing is that it has to run for a long time. That is only in case of some complicated surgeries. So I will come to that what exactly the radiation parameters will be there as such. This also I will 1 minute. Because many slides are there which I have I think my old presentation I got copied. Very sorry for that.
No problem, sir. You can go ahead. This is an important topic, and we will devote time to this.
Because this is a revised my presentation yesterday night I made that I could not bring, but of course it is, I can say that, a superset. So ARB also, I will not spend much time on that. Everybody knows that regulatory board has a very focused mission, to ensure that use of ionizing radiation and nuclear energy in India does not cause undue risk to the health of the people and the environment. And accordingly, the regulations, ARB being a very scientific organization, knowledge-based organization, it's not a regulatory body like other, administrative, organizations. So we regulate the science, we regulate, the important applications of nuclear energy, and we have many, rules and, scientific documents on that. But more importantly, this atomic energy radiation protection rules, I think, one should know about this. This only gives you about how we should ensure the safe use of ionizing radiation, whether it is a C-arm, whether it is a radiotherapy, nuclear medicine, or even the nuclear power plant. So these are all regulated under this act. I will again not go much into this. What I would like to say that Atomic Energy Regulatory Board has published various safety, codes, and these are mandatory codes which are related to each practice. Now, for example, for diagnostic X-rays, this is the code, that is the radiation safety in manufacture, supply, and use of medical diagnostic X-ray equipment, which gives the responsibilities of the licensees, responsibilities of the employer, radiation safety officer, responsibilities of the manufacturer, supplier, and so a copy of this code, I feel that should be available with each, clinic where the X-rays, which are the ionizing radiation sources, are being used. And this can be freely downloaded from the ARB website, that is arb.gov.in, and this is a mandatory document. It gives us various requirements as such. And one of the important responsibility of ARB is to prescribe the safe dose limits for the radiation professionals. Now the orthopedic surgeons, then the radiologists, cardiologists, neurosurgeons, nuclear medicine physicians, all are radiation professionals. In fact, WHO or ISS, medical radiological professionals they call, who uses the radiation for the for therapy or diagnostic purposes, and those who are involved in operating these ionizing radiation sources requires a dose limits to be prescribed by the Atomic Energy Board, and we have a 20 millisievert averaged over 5 years or 30 millisievert in a year. Means if any radiation expert works in the field and he is handling the radiation sources, his dose in a year should not exceed that 20 millisievert in a year, and average 5 years also is at 20 millisievert. This is the upper bound for this. This is only for informing you about these things. Now, ALARA, as you know, that it stands for as low as reasonably achievable. But what I have seen that this ALARA is many people interpret it as for the reduction of the dose. It is not for the reduction of the dose during any radiological procedure. It is mainly the optimization of radiation protection and safety. Means how you can ensure a very good quality image or a good visibility in the diagnostic image with giving a minimum dose to the patient as such. This is what is ALARA is there. So this calls for the protocols to be revised. This calls for even the protocol for, let us say, adult and children to be different. This calls for again many some important factors, like even the layout and design of the facility, equipment has to be type approved. So several factors are there in this. So ALARA is basically that the expert has to see that how best he can optimize, or how best he can see that the dose is given less with a good clinical information. So this is a very important one. Now coming to the C arm, you see that these are the patient is here. This is the scattered radiation. So the main source for the orthopedic surgeon during the surgery is this scattered radiation, because primary radiation straight away goes into the patient. And in case of a C arm, generally we see that the tabletop dose is of the order of 10 centigrade. And then when it comes out to the patient, it may be, let us say, some 7 centigrade. And from this, about 0.1% gets scattered, and then it is received by the orthopedic surgeon. And this can be stopped by the the adequate lead apron with adequate lead shielding, the lead apron, then your thyroid shield, then protective goggles. Then these are, and then TLD is of course the most important, which is to be worn below the lead apron. So we have to protect from the scattered radiation from the patient. This is very important. In this case, yes, X-ray tube does give the scattered radiation, but it is of a very low level, and our extremities being a radio-resistive, so there is not visible, or you can say that a very clear biological harm because of this scattered radiation, because extremities being a bone, a high density compared to the other soft tissues, so it doesn't cause much some sort of a damage. But this scattered radiation, since it passes to the gonads, since it may pass to the gonads, thyroid, and then so these are some sort of a radio sensitive organs. Now this slide, because since my copy of my presentation I will send you to all, and I find that this will be very useful to you. I won't be explaining much into this, because what we have considered here, some sort of a presumptions in this, like that maximum tabletop distance is given, age, then machine time generally is on, let us say 2 to 3 minutes for the procedure. Even ortho procedure goes into half an hour, 15 minutes, but the use of C-arm is maybe just 2 to 3 minutes. And then so that we have taken, then average patient dose is calculated accordingly, then scattered radiation is a 0.1%, that much is there. So these all calculations, if you see, my result will be that out of the 20 millisievert is the average annual dose limit to the radiation professionals, but what the orthopedic surgeon may receive is of the order of just 3 to 4 millisievert. So as such that from radiological risk point of view, definitely it is insignificant, but we know that any radiological risk is again a stochastic, means it is a probabilistic. So the effect may occur or may not occur. So we have to be very careful. It is like this when we start from home to the office. So we generally reach very safely, definitely. But there can be a probability, maybe 1 in 1,000, that we may meet with some minor or major accident. Same thing is when radiation passes to the body. So generally, it does not affect the DNA of the body, which causes the mutation as such, but it may straightway pass to the body as such. So this is like a probabilistic case, right? So there is no any safe radiation level. Let me, emphasize on this. Once the radiation passes to the body, it does its beneficial work, no doubt. But at the same time, it may be, it may also do some harm as such. So we have to be careful and optimize the things. These are the lead aprons which are being used. They are very effective, and lead aprons can reduce the radiation level almost 1/60th or 1/80th of the primary radiation. So once you wear the lead apron, it is a very safe for us. Yeah. Sir, kindly intimate if I am exceeding the time, please, because I know that I have.
Since this topic is very important, I would not stop you anytime in between. Please proceed. And already 2 delegates have messaged me that, sir, don't stop this lecture. So please continue, sir.
Thank you very much, sir. Thank you, sir. Now, these are the important, radiation protection parameters which are to be, kept in mind by the all honorable orthopedic surgeons. One is a collimation. So this collimation is very, very important. That a device regulating the area of X-ray beam exposure. So make sure the primary beam is confined within the large receptor boundary and limit the size of the feed. Because as I said, a fundamental, the point is that more the field of the radiation, more is the scatter. And scattering source is your patient. So if the patient is very thick, the scatters may be more. Similarly, if the collimation field size is more, the scatter will be more, and that scatter is for the occupational staff. Occupational staff gets exposed to the the scattered radiation. So we should try to minimize. So one important thing is a collimation. Collimation should be only to the area of interest so that scattered radiation is low. Then distance of the C-arm. This is very important. Now we should always avoid that X-ray tube is up and then the image intensifier is down, because as I said, 1 milligray in hour is a leakage radiation level permitted to this tube by Atomic Energy Regulatory Board. So this scatter may come this side as such. And here we have the islands, we have the the thyroid, then radio sensitive organs are there. Generally, the radio sensitive organs are the breast, thyroid gland, then bone marrow. So these are the radio sensitive, while bone is a radio resistive. So is there as such. So if tube is off, then your sensitive organs are here. So this orientation we should see very carefully, that we are always near the image intensifier side as such. See this horizontal orientation here. This is the image intensifier. X-ray tube is here. So this is the right position that the orthopedic surgeon are here on the image intensifier side. As a result, the scatter will not reach. Let me tell you that, as I said, 120 kV is the primary radiation from the X-ray tube. While the scatter radiation energy is very low, it may be 60, 70 kV, and it gets easily absorbed in the lead apron, or it may not reach also to the doctors. So lead apron is important, and tube should be as away as possible from the person as such. And then this irradiation using, this is oblique or lateral. This is very important. Generally, when we use the oblique or lateral, then what happens, that radiation passes through a large thickness of the patient. As a result, again, it gives the more scatter. And if the same area of the patient is getting irradiated, or the X-rays passes through because of the orientation, then there is a possibility that radiogenic tumor or reddening of the skin can happen to the patient. So we should focus the radiation, to avoid the, strictly necessary. And the same area of the skin should not be irradiated because of the, as I said, may be possible. Because this is very commonly reported in intervention radiology practice. In orthosurgery, fortunately, so far, Atomic Energy Regulatory Board has not received any incident involving excessive exposure. Let me share with you that in ARV, we receive generally in a month 20 to 30 cases where the excessive exposure is received. That is the value more than 10 millisievert. And this is mainly from diagnostic radiology. But in orthopedic surgeon, so far we have not, because they're because of the low kV, low mm machine, as well as they are keeping the safe distancing as such. So what I want to say, oblique and lateral C-arm angulation to be it has to be used, but if it is possible to avoid, so that the scatter can be reduced, and then the patient's dose also can be reduced as such. Then keep hands outside the area of the primary beam. This is very important, because if we don't wear the gloves, then definitely your extremities get irradiated, and if the hands need to be in the close proximity, then wear protective lead goggles, lead gloves, unless it and hinder the purpose of the procedure. What happens, suppose if the visibility is not clear because of the lead gloves, then automatic, and if you are using automatic exposure control device, then current will shoot. Because of the low signal, because of the lead gloves, current will shoot, exposure will be more. So we have to be very careful in using even the lead gloves. So whenever it is very necessary, you use, and generally avoid the hands in the primary. Our extremities are again radio sensitive. For extremities, the acceptable dose is 500 millisieverts. So while for whole body it is 20 millisievert. So it is a radio resistive, but as I said, there is always a stochastic risk. When radiation passes through the body, it may interact with the biomolecules, proteins, lipids also. So undercoat geometry leads to hand finger dose about almost 100 times smaller than the compared to the that overcoat. So this is very important to be kept in mind. Then you see this slide I have said only to inform you that this is the distance here. You see these are all the colored the contours, we call it as the same dose. So as you go away from the tube, the dose reduces. Here it is 4 millisievert, here it is 1.2, 0.5 and 0.25. So try to, generally we have seen that 45 to 50 centimeter is the place where the orthopedic surgeons stand from the tube, and here the dose is of the order of 1 milligram in an hour. So here we have to see that, and this is operating for 2 minutes. So as such, the dose will be very low, but then it will not have any detectable or any visible clinical effects. But there is, as I said, that the probabilistic risk always carries when we use the X-ray equipments. Lead aprons is a very important, as I said, that we have to be very careful to ensure the quality. So in every 12 to 8 months, you ensure the quality of the lead apron, do the fluoro with 110 kV and 1 MAS. And then see that there is no hair crack also into this as such. Now I will come to the straightway to some questions which Dr. Rajendra Chandak has asked me, that whether like a pregnant woman should not undergo X-ray examination. The pregnant woman can undergo examination depending on the medical necessity. And then, there has been studied by International Commission on Radiological Protection, as well as several United Nations Scientific Committee on Effects of Radiation. Similarly, International Atomic Energy Agency, WHO, they have published these documents on radiobiology. And they say that even if the pregnant woman is exposed to 50 milligram, still there are no clinical detectable effect. There is no fetus toxicity. There is no miscarriage. There is no malformation of any organ as such. But to have an abundant precaution, that we have to see that his work conditions are modified. Or if the patient is pregnant, we have to be very careful in the ALARA and radiation protection aspects. But yes, he can definitely undergo the medical examination. As I said, 50 milligram is a dose which is, there is no detectable effect. 100 milligram above, there is an effect. It has been observed. And here, the dose which is given by our C-arm is hardly just, 3 to 4 millisieverts, so much lower, in that 1/5 of the the dose, that is 50 milligram, which may cause some we can say that illness or some sort of a harm to the fetus. So pregnant woman can very well undergo this one. And Dr. Chandak has given a very good question also, that even if the orthopedic surgeon is pregnant, then patient also is pregnant, what to do? You see, the patient definitely, as a medical necessity, she has to undergo. She will get more benefits after this ortho surgery than this what the X-ray may cause. While so see the beneficiary. So benefit to risk ratio is very high in case of a pregnant woman. But when the pregnant doctor is there, then she is also very safe, but she has to see that her lead apron extends up to the, below the abdomen, and she wears all the time as such, because that time also the dose will be so negligible, even much less than what the pregnant patient gets. So ortho surgeon with the pregnant also can do the procedures very comfortably by following the precautions. Should pregnancy be terminated after radiation exposure? No, not needed at all. These are all misconceptions about the biological effects of radiation. Please, I mean, it has to be very understood properly. Biological effects are based on a very strong human data on past radiation exposures. A lot of expert committee, international level committees are there, and it has been observed that even as I said, with a 50 milligram, which is almost 2.5 times the annual dose limit, even if it is given at a time, some sort of FHS toxicity is reported. But yes, if it is above 100 milligram, 100 milligram is a threshold for chromosome aberration. It may start the chromosome aberration, 100 milligram. So there is an abundant caution that one may decide. And 100 milligram getting in orthopedic surgery is highly unlikely. So this is to be kept in mind, because the output of the C-arm is so low. If you are using the cath lab, one has to be very careful, because cath lab is having automatic control system. AC is there. So there we are unknowingly, with the beam may be on. The same is not there in case of a C-arm. Then how safe are radiological examination of extremities in the pregnancy? As I said, the same extremities are radio sensitive. Extremities are having the limit of 500 millisievert. It is very unlikely that even for any complicated surgery that she will, this will exceed as such. So she can undergo, provided her other organs like a skull, chest, breast is properly shielded, or it kept away and the beam is properly collimated. Collimation is very important in pediatric radiology surgery as well as in the pregnant woman. Such collimation is very important. We have to protect the different organs. I think this is what I wanted to share. And then Dr. Chandak has asked me, lead aprons are so heavy, so whether the light lead aprons are available. Yes, sir, light aprons made of some sort of antimony, bismuth, tungsten. So these are available. They are very light, and there are suppliers in India. That list I will definitely provide you, and I think you can use that. That effectiveness is as good as like lead aprons. So we can have those things, because using the lead apron for a long time also causes some ailment with the shoulders as such. So lead aprons are in the market in India, and these are tested by Bhabha Atomic Research Center, and then only they are allowed to supply. So I will share that list. It was in my presentation. I again apologize sincerely that in last hotspot I could not bring that presentation. So
thank you. Yeah, thank you very much. It was really